Welcome back. It's Medical Monday with East Cooper Medical Center. And East Cooper is the ABC News 4 hospital expert. And April is Occupational Therapy Awareness Month. And Rebecca Doolittle McFalls, a rehab manager at East Cooper, joins me now. Good morning.
Good morning.
And and I've seen the word, if I go to a hospital or a doctor's office, you'll see occupational therapist or occupational therapy. But what is it exactly?
Well, that's a wonderful question because a lot of time, one of my brother-in-law's favorite questions for me is, who did I get a job for that day? Because a lot of times people pair occupation with what we do for our living.
Exactly.
But really, an occupational therapist, we work with people that have illness, injury, or a disease process that's keeping them from doing the things that they would normally fill their day with or occupy their time with.
Oh.
So activities of daily living is our claim to fame in helping people get back to doing the things that give them quality of life.
Wow, I did not know that. Now, sometimes you have younger clients, and how are families, how are they benefiting from having their child see an occupational therapist?
Right. Well, I'm actually a pediatric occupational therapist with East Cooper, and we work with anyone from 0 to the age of 17 that once again needs some extra support to regain their ability to get themselves dressed, or they may need some help with their social skills. They may need some help with what's called sensory integration, being able to take in all of the things from their environment and make sense of it.
Oh.
And that's something that occupational therapists do a lot to help.
Now, what are some other diagnoses that patients would benefit from seeing an occupational therapist? What are, some of the diseases or diagnoses that they may get that we might be more familiar with?
Occupational therapists work with anything from children with cerebral palsy, autism, fine motor, visual motor issues, or in our older populations, people that have had a stroke, or have any sort of cognitive decline, someone that's had a hand injury or a knee replacement that's having trouble getting back to doing the things that they need to do to have that quality of life. The occupational therapist can be integral in getting them back to doing it.
Yeah, and getting the confidence, really true. And so the people, especially if it's a younger person or maybe even an older person, their caregivers, are they taught certain things that they can continue that at home? Absolutely.
One of the favorite things that I do every day is I train families to understand what they need to do in a situation of caregiving. So, for example, if your mother had a stroke and she no longer was doing as much to get herself up and going each day, the occupational therapist is going to show you ways to do adaptive dressing, going to show you ways to help them transfer in and out of a chair. They're going to do everything, or maybe even adapt a spoon to help her to hold it herself again.
Now, do you sometimes work on their motivation to do those things? Because sometimes people have to have a will to want to be rehabilitated and get back to doing what they want to do. Do you teach them?
We do, and a lot of times we like to say that motivation comes with competence, and so we show people ways to do something differently that makes them feel confident again. If you feel confident, then you're motivated again. And so a lot of times we've had families say, not until we came to East Cooper and had occupational therapy did mom want to do any of these things again. And then it just really reinstates a lot of that natural family dynamic again.
Now, Rebecca, since you said that, what really sets East Cooper Medical Center aside when it comes to occupational therapy from any other practice that someone could go to?
Well, East Cooper, we have occupational therapists that work with the youngest patient through the lifespan. So we cover the whole spectrum. We have extremely well-trained therapists that are trained in anything from orthopedics to neurorehabilitation to pediatrics. We give one-to-one family-centered care.
And of course, that's what East Cooper Medical does. They keep you, they make you feel like family.
We like to think
One big part of the family. So if they want to get in touch with you and maybe start coming to see you guys, what should they do?
Well, all they would need to do is let their physician know that they really think that their loved one would benefit from occupational therapy, and they can refer over to us, or they can call us at 416-6633.
All right, Rebecca, thank you so much.
Thank you.
Appreciate it. We'll be right back.